in the heart of Kent.
I take it this is cheeky.
There's a vet's practice like no other.
He's very weak.
Whatever the creature, there's someone here to treat it.
This cat's in heart failure.
Sorry, sweets.
For the very first time, the surgery and its staff have been rigged with cameras.
OK, I don't hear heart.
Rates of adrenaline to make her heart go.
I wasn't expecting it to be this massive. This is unbelievable.
To give us a unique view into this extraordinary world. A dedicated team.
That looks like it's about to fall off.
Saving lives.
Yay! Well done.
Making difficult decisions.
We've got to make sure that we don't get to a stage where he's suffering.
And treating animals that others won't.
Not every day we see a goat in here.
In the clinic today.
Hi. Come on through.
The goat has smelly feet.
Calm down.
A Daegu dental appointment gives the staff a fright.
He is breathing now, but I'm not happy with him.
And a chameleon has lost his lust for life.
Oh, are you going black? Oh no, matey, are you so sad?
Expect the unexpected.
Good job, everybody.
Inside the vets.
Right, so Lucy is having her orthopedic op with Christoph now.
Not me, the dog.
Yeah. There's never any 2 days that are the same. And we've got Leo, whose tube is blocked, a tortoise with a feeding tube. We try and plan ahead, but it's always, every day is exciting. Oh, we've got some Daegus coming this afternoon. Great.
Every day is just so completely different, and what you have on the diary is not how your day is going to end up.
Gucci's that's just that little dog.
I thought you called it goat cheese.
Goat cheese. That would be unusual.
You could have goat cheese, halloumi, Gouda.
Nobody can do this job on their own, but either a vet or a nurse. It's just impossible, wouldn't happen.
Otherwise, we would leave till midnight every night.
Well, I mean, you know, some days do go like that.
Well, yes.
But, yeah, to make every day not like that, we all work really well together.
The Montgomery Clinic gets all sorts through its doors. But not too many of these. Doing a lot of this. Owner Anne-Marie and her mum Elaine are here with Saxon.
Today I've come in to see Clive with Saxon. He's 6 years old. He's a pygmy goat.
Well, that's what I was thinking, so I might just sweep it to the corner. That's fine. Don't worry. I'm just going to leave that there.
He's been having some problems with his hooves. Yesterday, my husband and I noticed there was a suspicious infected smell on his hooves. We couldn't quite locate exactly what the problem was. So we wanted to nip it in the bud, so I brought him in today just to have his hooves checked over.
It's not every day we see a goat in here. I swear I did a double take when I was looking up. Is that a dog? No, I don't think so.
I had goats when I was a little girl, and I've got 3 young boys myself, so my first train of thought was just to get goats.
There were 3 goats, and one of the boys at school, they were doing the Vikings, and so they were Saxon, Norman and Viking.
Was it a family pet or part of a...
Pet. I'm a mad goat lady, yeah.
It's been lovely for them to have hands-on experience with the goats, and they come out with their friends and run around, and our dog goes in with them, so they're just loved family pets.
While the waiting room sits and marvels at Saxon's defecatory prowess, Clive has readied himself for his patient's arrival.
Hello.
Hi. Come on through.
Hi. Caroline. Hello, Caroline. It is indeed.
So Caroline's a large animal vet. She's spent some time with us today, and it's just lucky that we're here. Right, so this is Saxon, and what have you noticed? I understand there's some feet issues.
Yes, I was doing his hooves yesterday with my husband, which we do every sort of 4 to 6 weeks, and noticed that they seem very overgrown compared to normal, given that it was a normal gap that I'd given. And then suspicious smell, and then on inspection I realised that each hoof sort of in the middle has got a slight hole in the bottom.
Taking a peek at most other patients' feet isn't usually too much of an issue, but most other patients aren't Saxon.
Shall we put him on his bottom, if that's all right, and then with his feet on it?
You to position how you want.
We used to have a couple of pygmy goats. They were really good fun to have, although they can be hard work. If they get cross with you, you know, a couple of horns in your bottom when you're trying to fill their water bottle. If we just sit them up like that, okay. I'm sorry.
Good, relax.
Calm down. Or we can just fight with him. Or what if I hang on to him?
Oh, here we go. He's going down.
There we go.
And then when I do his hooves, he's used to being held.
Okay.
Find where it is. Not like that.
So, there, you can see.
You see?
Yeah.
With Saxon pinned down in a 3-man half Nelson, large animal vet Caroline can get a proper look at his hooves.
If you feel that heel, feel how nice and firm that heel is.
Yep.
And then you feel this heel here. You
Okay.
can see how it's soft.
Yeah, it's tender.
That's going to be one, tender for him, but
Okay.
also at greater risk of a puncture and for an abscess or infection.
Okay.
It's a bit like walking on gravel with bare foot rather than
Okay.
flip-flops on.
Okay.
Anne-Marie has been spoiling Saxon with frequent pedicures, but has it been too much of a good thing?
My advice would be don't trim unless they're lame, unless they've got really long overgrown
Because
toes.
these yesterday were literally, you couldn't even see the sole, they'd grown right
But
round.
that's a protective.
Oh, is it?
does protect them. But equally, you can get loads of mud in there and then infection, and then that could be a disaster. But current thought is less trimming is better.
Right.
I think keeping it open and out of mud is probably the main thing, and I think
Which at the moment is almost impossible with all the mud.
Yeah, I know.
I feel guilty now that I've
No,
overtrimmed.
yeah,
I know.
It's absolutely not.
Yeah.
And it's
Yeah.
also very normal for breeders to recommend
Yes, to
that.
recommend it.
Yeah.
Yeah.
Often because the breeders are in the show world and it's the done
Yes.
thing to have
Yes.
very tidy toes.
Yeah.
But the fact that it's already better from what it was yesterday.
Yes.
Just
Yeah, it's
because
not smelly. I mean,
just
it
because
was
the mud's away.
Yes. Yeah.
So I think if we can use antiseptic on the areas.
Yeah, I dipped them in Hibi Scrub yesterday.
Great. I would definitely say look a lot more often. If you once a month get hold of them, and if there is a big chunk of mud or a bit of stone that gets wedged under it, you can just get it out.
Thank you.
These feet are
Sorry if
nowhere
I've
near
overreacted
stiff.
a little bit, but
Well, I think
smell yesterday.
if it went on, it can turn into something very nasty.
Yes. Luckily, I've caught it really early, so it's just for me to keep an eye on him and cut back on the clipping of the hooves a bit, not to be quite so overzealous.
All right.
Great, thank you.
Okay,
I'll
great.
go now. You too,
Great.
thanks, bye.
Thanks.
With any luck, Saxon's infection will disappear in a matter of days, which means he can get back to doing what he loves best.
He's known to do Spanish dancing.
Oh, yes,
He gets up on the
lovely
table.
dancing,
Yeah, he
yes.
does sort of clippity-clop stuff up on a table. He has to sort of show his worth and make you know he's present, doesn't he?
Yes.
Yeah.
Lisa Sullivan is a rodent fan, and after test driving a few different species, she's finally found the loves of her life.
I actually had some gerbils and we lost the last gerbil and went to get some more and they didn't have any, and then we just happened to see the dagoos in the shop and absolutely fell in love with them, and so home they came.
Come through, pumpkin. Oh. Do you want a hand?
No, it's fine. I think they've taken over our lives, actually. We've got 3 big cages in our front room, and they've just got such wonderful little personalities. You fall in love with their characters and they're quite intelligent little animals, so you can't just leave them like you would a hamster.
So tell me who's who.
So, Red is looking at you right now.
Hiya. Hiya.
With the little goggles, as I call them, round his eyes.
And he's got more white round his ears as well. Right, OK, just so that I know who is who.
Dagoos originate in Chile and are highly social, which is why Mr. Grey has come to keep Red company. Dagoos have a sophisticated sound repertoire to communicate with each other and the TV.
If you've got sheepdog training on the television, they will whistle back to the shepherd because the noise obviously must be somewhere on their range of different noises, and it's quite amusing to sometimes when you sit there listening to them having this conversation with the television.
What's the other one's name?
Mr. Grey.
Mr. Grey. I'm going to put that down as well.
But Red needs his teeth filing down.
Red's having some problems with his back teeth again. He had an operation before to burr them down, and he's been very wet around his mouth again, which is a sign that his teeth are causing him problems.
Yeah, OK. All right, my darling, we will speak to you a bit later.
See you later. I hope they don't cause you too much trouble.
They won't, they'll be fine. Bye. Right, you two. Come on then. He's quick.
The aim today is to keep Red asleep for a very short time to avoid any risks to his health.
Oh, darling, go sleep.
And to reunite him with his other partner in crime, Mr. Grey, as soon as possible.
Right, okay. The back of his mouth seems fine.
Is his tongue okay? Doesn't need pulling forward, it's just he's making a bit of noise when he breathes.
But just minutes into the operation, there's a problem.
Okay, I'm not happy with him. Okay, take that out. Not still.
Do you want a hand? Yeah. What do you want? Yeah, just can you have the stuff ready? Emergency.
He is breathing now, but I'm not happy with him. I can't monitor him properly and hold the anaesthetic. Yeah, thank you. That would make me much less stressed.
Shall I put him back on ice then?
Yes, put him on to 2.5 for me.
Yeah, he's waking.
I may have to turn him up in a minute though, Tip, because he might start to feel... I'm sorry about that. He was just breath holding and I wasn't happy with what he was doing.
No, that's fine.
Anaesthetising small mammals can be very tricky. We're using a gas anaesthetic and you need to get the level just right. If you make them too deep, they'll stop breathing and their heart will start to slow down, and if we don't correct that very quickly, that can be fatal. If you keep them too light, then they're going to be moving and they're potentially going to be in pain. You really have to keep them where they can't feel it, but their heart and breathing is at the right rate.
Okay, he's breathing much better now.
After finally succeeding in getting Red's anaesthetic levels right, there's now a new problem. Vet Lindsay's spotted something in Red's mouth.
I'm not sure if it's actually the tooth that's the problem or if there's a growth in the mouth.
Because there is this tooth that's growing a bit funny.
Okay.
I wonder whether to take a biopsy of that tissue while we're here. Sorry guys, this is such an awkward angle to get at this tooth.
My big hands are in there as well. I was coming through to say, do you want me to send someone on their lunch? But
Not right now.
Not right now, but...
Right, okay, I have taken that tooth right back. There weren't really any spurs.
I mean, could it have just been that weird tooth that could do it?
I suppose it could have been. I do worry.
Quite jiggly.
I reckon we get him awake, get him on antibiotics and anti-inflammatories.
I would much rather have him awake.
Yeah,
Okay.
and
If it don't resolve, then re-examine it.
yeah, for bloods and possibly biopsying that.
Oh, my back.
We need to hit the...
Staying in that one position where you're sort of slightly bent.
I always have a bad back the next day when I do a dental.
The worst I ever had is when I did that GDV with Clive and I was so stressed I think I was just clenched the whole time and the back of my thighs.
Having kept Red only lightly anaesthetised for the last half an hour, he should wake up in minutes.
It was extremely stressful. You don't want to lose your patient. You don't want to lose any patient, especially under anaesthetic.
Unaware of the backstage drama, Lisa has returned to collect her beloved rodents.
Hello. So, Red wasn't quite what we were expecting under anaesthetic. So, right at the front on the right-hand side, one tooth was kind of growing forward and was quite stained. The tissue around that tooth was then quite inflamed, and I've burned that tooth right back as much as I can.
Yep.
And I'm going to send him on antibiotics and anti-inflammatories. And then when the post-op checks, we'll just see if that tissue's going down.
I'm relieved that he's actually come through it all, because while he was under anaesthetic, he didn't respond too well to it. But we got through it and we've come out the other side, so it's a relief. We're back for a check on Monday, so medicine over the weekend and just see how he's responding, and then go from there. If it's not responding, we'll look at further treatment.
I'm sure I was promised a cup of tea about an hour ago.
Yeah, where did that go?
Tea is extremely important to the practice. Tea keeps us going.
I think the clinic runs on tea. I think we're all very big tea drinkers.
Tea goes without saying. It's like oxygen.
Yeah, it is.
The day the kettle broke. Oh my God.
I know, we talked about that. That was a bad day.
You can see it's ingrained on all of our memories.
The Montgomery Clinic has a reputation for being able to treat all creatures, great and small.
Hello, darling.
Who have you got there?
Shadow.
Would you like to just take a seat for now? Thank you.
And Barry Hazard has arrived with one of the latter.
This is Shadow. He is a... Oh, blimey, I've forgotten what you are. Sorry, mate. A Yemen. It's a Yemen chameleon. I had to think then. I've had him since he was a baby. He's 2 years old.
Barry came into the clinic a few days ago with Shadow, worried about his behaviour.
He started looking a bit funny in the middle of the week. He was hanging upside down all the time, and that's not like him. He normally sits and climbs around and everything else. He's quite active, like he is here now.
Shadow? Hello, come on through.
But Shadow isn't improving, and Barry's getting worried.
He wasn't very well on Saturday, so I took him to the vets, and it turned out that he'd got an infection. So he's had to have blood tests on Saturday, calcium, and was force-fed because he was a bit underweight, and today he's had to come back for his other antibiotic injection.
Right, so I think you saw my colleague Joe over the weekend. How's Shadow been doing since then?
He's picked himself up a bit. He has had some meal, eaten some mealworms, and I've seen him actually have a couple of locusts.
Okay.
And he ain't fell off any of his sticks.
Okay, that's good.
Barry's very upset Shadow's not responding to treatment as quickly as we had hoped. Chameleons often don't show symptoms until late stages of illness. They do take a long time to get better after you've started treating them.
All right, Trouble. Hi.
Sharp claws.
Yeah. Ow. Unnecessary. Okay. And off we go. There we go. Hey, gorgeous. Shall we see what we can do with you? Yeah, I know. Okay, you pop back in here then. So what I'll do, I'll pop him out the back. We'll get him some food and some antibiotics in, see what we can do about bloods. Come off my finger, please. Thank you. Lovely. Do you want to have a seat? And then I'll take him out with the nurse and we'll get him done.
Okay.
Get you sorted out, eh? All right, lovely. Thanks very much. Come on, Trouble.
Well, I'm nervous to find out what's going on, but he's a lot better than he was because on Saturday he wouldn't even hold his head up.
Student nurse Tip will help Lindsay to try and get some blood.
No, don't move, don't move. So I could probably have taken 1 mil from him safely, but he's ill, so I think 0.5 mil is fine.
Okay, you ready to put some pressure on?
don't really want to take much more than that from him. Oh, damn, buddy.
Shadow's appetite has faded recently, so it's vital Lindsay tries to get some food in him.
Oh, dear.
To avoid getting bitten by Shadow, Lindsay needs to prop his mouth open, by fair means or foul.
I know it's my own fault for shoving my hand in your mouth, but it really hurt.
Oh, you're going black? Okay.
Are you not happy? Oh no, matey, are you so sad?
2-year-old chameleon Shadow isn't well. Vet Lindsay has taken some blood and force-fed him. An antibiotic jab is next, after which, hopefully, he'll start to recover.
Oh, damn, buddy. There we go.
All done?
All done. We got some more blood.
Yeah.
I've given him a feed and I've given him his antibiotics.
Right.
He's super mad now. Aren't you?
Thanks.
Hey?
When do you want to see him again?
3 days for his next antibiotic, and hopefully we'll have some blood results back by the next time you're in.
Right.
Hey, don't be too angry though. You did manage to bite me, so, you know, we each got one.
Oh, well.
Lovely.
OK, darling, thank you.
Very much. Bye, gorgeous. We'll see
3
you later.
days.
Yep.
No matter what it takes, we'll do it. If you've got a pet, you've got to look after it.
Next into the clinic are Roy and Madeline Woolston and 13-year-old miniature pinscher Roxy.
All right, yes, Daddy's here. Oh, Tremble's baby girl. Roxy, it's okay, my bubba. Leave it alone. Roxy, oh, he's lovely. He idolises Roy.
We bought him in Spain. He was starving in a pet shop out there. He was only 6 weeks old when we got him.
It's all right, my baby girl, I promise.
It's a boy.
Oh, I beg his pardon.
My fault. I always wanted to call the dog Roxy, so that's the name we got.
Oh, OK. I'm sorry, little man. I do apologise. So that's, I'm not talking to you, he says. OK, we're taking the lump off. I'm assuming it's this lump here, is it? OK, so that is left for.
Roxy's had a lump on his arm, it's like a little plum.
It's got bigger in the last 6 weeks. He keeps licking it and he's made it bleed and it's becoming very inflamed.
So when did he last have something to eat, Mum?
Well, 6 o'clock last night.
6 o'clock last night, perfect.
Today they're going to remove the lump from his leg and send it for analysis to make sure it's nothing too bad.
It's very worried, isn't it, little man? Once he's got his pre-med into him, life will be a lot more chilled. It just relaxes them a little bit, makes them not so worried about life, OK?
His age, he's 13 now.
Yeah.
It's a bit of a risk using anaesthetic on him, but it's annoying him so much.
I'll wait here till you've gone then and we'll speak to you a bit later. Take care. We'll see Mummy Daddy later, baby boy. He's a good boy. He's okay. Come on then, let's go find your bed.
Even though he's having a general anaesthetic, Roxy's op should only keep him away from his doting owners for a few hours.
Oh, it's awful, awful feeling.
But he's very strong-willed.
Let's hope he is, yeah.
You good boy. Oh,
He's shaking so much.
he's all right, little man.
Absolutely
Yeah,
lovely
he just
dog.
needs
He
to
just
be
needs to be.
Should we be eating in prep room, girls? What would your college tutor say? We have a kitchen. Thank you.
Oh, teacher Ed!
Love you, girls.
Although the lump on Roxy's leg isn't difficult to remove, there are major blood vessels in the area, so vet Laura Beth must proceed with caution.
I'm going to try turning him down. Heart rate's only 80. We're a little bit puffy.
This lump, it's really starting to irritate him and upset him, so we are going to send it off and just check that it's nothing nasty.
Look at those blood vessels under that skin.
Massive. Massive. We had to weigh up whether it was worth doing this or not. But because it's caused him such bother, he's just going to be miserable if we don't try. So decided with the owners that it was worth the risk. Lovely. That's clearly just fat. Probably just start the whole thing off.
Most of the growth appears to be fat, but Laura Beth has spotted some other tissue that looks suspicious. And her head cam captures the problem in detail.
Look, the blood vessel going up there.
It's going into the lump, isn't it? So this lump has got a big blood vessel supplying it, so we're just tying that off.
Is that bit going to go off as well?
I think, yeah, because I would be more concerned about that bit than this. This is just a blob of fat. So I think, in preference, I would send this.
After just 30 minutes, all that remains is to stitch Roxy up, but his temperature has started to drop. Nurse Faye is ready with her orders.
Lucy, could you please ask the girls to put a towel in the tumble dryer to warm up for this little man? His temperature's only 36. Okay. And maybe do some hot water bottles in his kennel. Thank you. Good boy. All right, darling.
Hey.
Hello, Baba.
So funny. Oh, dear. It's all right.
You know.
Hey.
Shall we get you back to bed and tucked up? Do you reckon?
It's been over 7 hours since Madeline and Roy handed over their pride and joy to the staff. Now they've returned, still not knowing whether surgery has been successful or not.
For Roxy. Hi, coming through.
Some reassuring words can't come too soon.
You can go home, little man.
He's been really good for his anaesthetic, really nice and steady, recovered really quite quickly. I was expecting him to be snoozing all afternoon, but he's up on his feet within about an hour. So, so I got the whole of that lump off. Underneath it, I'll show you. If you're not too squeamish, but it was a fatty lump, so it's just lipoma underneath. But then we have got this thickened area over the top, but we'll send that off and just get them to double check it for histology.
Come on, little man.
There he is.
Who's in here? Hello. I gave up with the coat because I wasn't sure which way round.
Oh, that's all right.
Hello. All right, darling.
I don't think we need to worry about any antibiotics at this stage. Obviously, if especially if he starts licking at it or any problems and it gets infected, then we might need to start them. But it looked fine, and we don't like pumping antibiotics in the system unless they need it. So, check up at 3 days and 10 days. We'll remove the stitches hopefully at the second checkup, all being well, and just give us a buzz if you've got any concerns at all. All right, but no, really pleased with him. He did really good.
Oh, good. Thank you very much for what you've done.
No
yes,
worries.
thank you.
Right. Take care.
Bye.
It's all right.
Madeline and Roy must now wait for another 3 days to get the biopsy results.
Don't know what we'd do without him.
No.
It's like having a person missing. I don't know why. They get right under your skin, don't they, animals? Oh.
It's 3 days since Barry came to the clinic, worried about his pet chameleon, Shadow. Since then, despite being force-fed and given antibiotics, Shadow has been struggling.
Last night he was getting worse because I had him out and he walked from where I got him on my hand, he just walked to there and he didn't move at all after that.
Shadow? Oh, Shadow, say no.
He just had no energy, he kept losing grip. He wouldn't climb. When I put him back in his viv, he went back on the floor and he was still there this morning when I got him up.
Hello.
Well,
I know, too many excited doggies. Hi, Shadow, how are you getting on?
It's getting worse. We watched him eat 2 locusts and he ate 2 mealworms, and that is it.
Okay.
What do you think, Ollie?
The problem with reptiles is they do everything quite slowly. They get sick quite slowly and they get better quite slowly. And it's whether we can get the betting better being quicker than they're getting sick. He's certainly gripping quite well though. You know, open your mouth for me.
He's stroking on the top of his nose, he opens his mouth.
Ah, good hint. Yeah, he's got a little bit of increased respiratory secretions there.
What does that mean?
So just, it could be a sign that he's got a respiratory tract infection or a bit of a mouth infection, but he's already on antibiotics, so we're kind of doing everything we do from that side of things. I think all we can do is keep trying. He's on all the treatment, really, that we'd recommend.
Right.
His bloods haven't given us anything else particularly to aim for.
No.
But yeah, so I'll give him his injection, I'll give him a feed.
And I'll disappear.
Yeah, and then I'll bring him back out to you.
Okay.
He says, I'm attached to your hand now, you can't put me down.
Lindsay needs to get more food inside Shadow, but how to keep his mouth open? Student nurse Lauren is on hand to help.
Have you got him? Yeah. No, don't do that, don't do that. Oh, Jesus, what have you done, Switch?
But Shadow isn't having it.
Joe?
Time to call in the vet who first treated him.
So I just tried to put that in between his mouth and he bit down really hard. Just so I could get the tube feed in.
You might have just called his cum. Just try something gentle. He's much paler than he was. Looked very unstable.
Okay. He just made a horrible noise, which I did not like.
I felt like it went in really nicely.
But what little food Joe can get into Shadow, he doesn't want.
I think he's really sick. He's just got a really funny colour as well.
He did go really dark after I gave him his feed last time.
If he can't keep his food down, Shadow's condition could quickly become critical.
Come on. Yes.
Come on then, he
Come
knows
on.
where he's going.
Come on.
It's only a few days since the successful removal of a lump from 13-year-old Roxy's leg.
So how has he been since Tuesday?
He's been fine in himself, hasn't he? Yeah.
Okay, Roxy, let's have a look then.
Roy and Madeline are not only desperate to hear Roxy's biopsy results, but also to discover why there is blood on his bandages. Vet Joe is familiar with the case.
When did you notice there was blood on the bandage?
On a Wednesday.
Yeah, but whether it's because he's been biting or not, I don't know. It's not doing nothing, no.
Boy. No, don't lick it, no.
Don't lick it.
So it doesn't look as it should really. It's very red and inflamed.
So I think that the licking is causing infection. If he's just chewing it constantly through the bandage, he's still causing damage. It's all right, sweetheart. Is he on antibiotics at the moment?
No.
Okay. I think that we're going to have to start him on antibiotics, but also I think that he's going to have to wear a buster collar. And I know they don't like the collar, but it's better to have it and be a little bit upset for a couple of weeks than to having it to get a severe infection and open up the wound that should go on for much longer.
Yeah.
Okay.
Yeah.
I'm sorry, sweetie.
It's all right, they'll be back in 2 seconds.
Whilst Roxy gets his bandages changed by Joe and Nurse Lucy, Roy and Madeline wait anxiously outside.
I'm just going to have to persevere with it on him. I know it's not very nice. You've seen it. What? I don't think you've got my job, Sharon.
I hope Green is okay, Roxy.
I think Green's good.
Stay here for a second. I need you to come back through.
Nice colour, isn't it?
Well, I just realised after I put it on, I should have done a red one so it was coordinated. So sorry about that. Next time. So the main thing is I want to keep it dry. If you do see any swelling above it or it seems to become more painful, then it come in sooner because it might need to come off. Obviously, you want to try and stop him chewing it at all. So I would use the collar. And the results are back as well. So it's basically a proliferation of the skin. So it's not a cancerous type of lump. This was benign. But basically, he had something called furunculosis, which is sort of a severe inflammation and infection in the hair follicles underneath. So provided that the wound heals okay and that all settles down, hopefully that will be the end of it. We don't expect it to cause any ongoing issues.
I'm glad it's all removed anyway. Yes.
Yeah.
Okay.
Thank you very much.
That's okay.
Thanks. Just relieved. It was a worry that it might be cancer, but it turned out to be not so. Just hope he picks up now.
Yes, I don't know now. Yes, all right.
Four days ago, Rodent Red endured an unexpectedly traumatic dental appointment. And whatever the anaesthetic did to him, it wasn't good.
Red was antagonising Mr Gray. He kept running up to him and sort of poking his nose at him and tapping him, and then of course he'd turn around and warn him off, and then eventually just had enough. And off they went in a little ball and had to be grabbed and separated out, just for their own safety more than anything. But they're pretty much back to normal now, thankfully.
Red. Hello. Hi, Red. You got your friend with you today? Oh,
yes. Oh, you say friends. They weren't friends Friday and Saturday. You haven't seen Red. He's got a bite on his face.
Oh, Red. That's not on.
Well, you got Mr Gray as well, so, yeah.
Well, then both of you need a slap on the wrist. Right. Let's have a look, Trouble. I'm glad you two are friends again.
So am I.
It's really stressful, isn't it?
It is.
I have to say, when I was introducing my two cats, it was one of the most stressful weeks I think I've ever had. And it's so silly, but I really needed them to just get on.
Yeah.
Scrapping with Mr Gray clearly wasn't enough for Red.
No, stop it.
He's still in a frisky mood.
You fidget.
You
can imagine what it's been like trying to get the medicine in.
Yes.
Got one leg. Just like the other leg.
There we go. Yes, that's looking much better. I know, I'm so mean. I am the most horrible person ever, aren't I? You are much less drooly.
Yeah.
So it's literally that one tooth that grows forward must be causing that inflammation. Right, so we think if we're having similar episodes in the future, we're just going to have to have him in, burr that tooth right back.
All good. He's been signed off healthy and fit. We should be good, hopefully, for a good another 6 months or so yet. Fingers crossed.
All right, you two behave yourselves.
Lovely. Right.
All right, thank you. Bye.
While vets Joe and Lindsay have been attempting to feed Shadow, Barry has been too anxious to go home.
Unfortunately, chameleons just don't do well in this country. They really struggle. The only other thing we can think of doing is keeping him in hospital so that we can feed him a few times a day and see if we can get him a bit better.
I don't think you're going to.
The other options are trying more at home and seeing if we can get him over this hump. But if he's not improving...
He's not, it's getting worse. He won't even climb up on his vines.
Right.
He's on his bottle all the time.
So, do you want to carry on, or do you think that you need to put him to sleep?
I think that'd be the best answer. He's suffering, and I don't want him to suffer. The infection was getting worse. He wouldn't eat, and it was just fighting a losing battle.
What I usually recommend is that you say goodbye to them now.
Yeah, you take
and then I take him through, because that way I can give him an anaesthetic before he has his injection, and I think that's nicer for them. They don't worry so much about it then. I'm sorry you couldn't
That's
do
all
more for
right.
him.
No, you tried. You've done all you could.
With Barry resigned to Shadow's demise, all that remains is for the staff to ensure that Shadow doesn't suffer as they put him to sleep.
No Shadow, darling.
Right there.
When you have to give them the news that an animal has got something...
That we can't fix them anymore. There's nothing more we can do.
And when they're coming to terms with that, that can be very difficult. Even though it's really sad, you always have to think, well, at least the animal's not suffering anymore.
I miss him. But unfortunately, it's part of life of having a pet. You know, they're going to go sometime, but he just went sooner than I expected.